Body mass index, commonly known as BMI, is making the headlines yet again for its inaccuracy. But this time it's the Lancet study which has pointed out its limitations. So, to discuss further on this, we have with us Dr. Swamikannu, a diabetes specialist from MGM Hospitals, Chennai. So, thank you so much for joining with us. Firstly, sir, I just want to ask what are your reactions on these specific limitations that the study has pointed out, sir?
I think this Lancet study has stimulated a lot of interest in the BMI because we have been thinking about this for a long because all of us are not same. If you take Europeans and ours, everything is different. They are very tall, their structure, the constitution is different. And even if you go over minor details, the blood vessels in the heart, they are very small for the Southeast Asian people compared to the people in the West. So I worked on either side of the globe, so I know. Their blood vessels I've seen in the cath lab, it used to be very big. Like, the arteries in the leg, the size of the arteries in the leg. Whereas, the Indians, especially the Southeast Asians, I've seen people in the Gulf, people in the Southeast Asian countries, like, Philippines, Vietnam, Thailand, their coronary arteries are very small. That is why the heart attacks are more common in Southeast Asians, in younger people than the West. So we are different in most of the time because we are small constitutionally, we are small, and our average weight is less. So many things are different. So the BMI is primarily based on the Western literatures and Western studies. We have been thinking if there could be any other some finding that will add to the BMI. Now, Indians generally we are called thin fat Indians. We'll be thin, but if you look at the belly, it will be like pregnant women. So that is called thin fat Indians. So if you take their BMI may be normal, but we'll forget the fat in the belly. So we are indirectly prone for the waist circumference. That is called, you take the measurement of just above the belly button while standing. That will indicate obesity in where the patient's BMI may be normal, but waist circumference can be abnormal. So we will be missed those patients thinking that BMI is normal. We can go ahead with the normal activities without taking any precautions against exercise, diet, and then so many things, prevention of non-communicable diseases. We'll just ignore those things. But this waist circumference is very useful for Indians especially because that indicates abnormality in when we add to the BMI, it may add value to this.
Do you think it is high time India should stop considering BMI alone as a measure when it comes to determining obesity and treating diabetes as a result of it?
Absolutely, you are absolutely right saying that because we are different. We need to have our own method of assessing people at risk. So we should add just instead of just BMI, we should also use the waist circumference as a risk factor. Though whoever has got a high waist circumference, they should be considered as a high risk factor, especially in people with diabetes. Now we are talking about reversal of diabetes. Reversal of diabetes cannot be achieved without the melting the fat in the belly. So we should go in for another measurement like circumference. Nowadays, drugs that are being introduced for the overweight, they look at the weight circumference reduction. If you look at the new drugs that have come into the magic drugs that they call the magic pills that have come into the market, they claim it reduces the weight circumference. So it has been proven, people have taken into account. It's not that they don't know, but it has not become popular among the public to know about this. This belly fat, BMI may be normal, but belly fat may be abnormal. So considering this we have to focus our treatment based on the BMI plus circumference, abdominal circumference, maybe waist circumference may be very useful tool.
Sir, there is also a lot of chat about how AI will come and contribute a lot to the health sector. So, in the future, do you see a lot of advancements in AI regarding this obesity determination or measuring obesity? How do you look at it?
I think it's going to be fantastic to incorporate artificial intelligence into this BMI measurement and predicting people who are at risk. If you include the BMI plus waist circumference using AI tool, and there are interesting things coming around and all around, not only in BMI. And I can go on telling the whole day how it has changed our practice using AI. It's going to play a major role in the measurement as well as the prediction, and people at risk can be identified early and appropriate actions can be taken. It's going to change our way, the way we live and the way we practice. It's going to change.